Hello, nurses, doctors, and healthcare workers alike, and welcome to your Introduction to Interruptions. This is the very first entry in the 6-part series that will teach you how to properly manage interruptions, focusing on the healthcare environment. Now, even though we're focused on healthcare, the lessons learned here are applicable to any interruption you may face in your life, so if you feel you get interrupted a lot outside of work, this may help. Now, why do we care so much about managing interruptions? Well, interruptions are the leading cause of clinical error in the nursing profession and throughout the healthcare environment. Currently, nurses face an average of about 8 to 21 interruptions per hour, with each additional interruption being linked to nearly 13% increase in task error rates. In all, this comes out to about twice the number of errors made when interruptions are present versus controlled environments where they are removed. The link between interruptions and clinical error is very well established in nursing literature, culminating in this basic rule. Interrupting a task for any amount of time will always increase the likelihood for primary task error. Now, this connection happens, in part, due to the fact that people do not manage interruptions well without instruction. This is because most people switch tasks reactively in response to an interruption. To switch reactively means that when an interruption happens, people will usually attend to the interruption as soon as cognitive resources become available, regardless of whether switching tasks is actually beneficial or detrimental to the overall task performance. Basically, people don't automatically have a framework for deciding when switching tasks or not is a good idea. And this is the core issue that is underlying the link between interruptions and error. Throughout these lessons, you will learn how to make the correct decision quickly when you are faced with an interruption. Now, before learning how to handle them, it is critical to understand exactly what an interruption is and the parts of an interruption. It's worth noting that there are two distinct kinds of interruptions. We have internal interruptions and external interruptions. An internal interruption, which is also called a self-interruption, originates directly from your own thought processes. This can be as simple as stopping in the middle of a data entry task to check your email. Now, in contrast, external interruptions are generated completely outside of your control. These are like an incoming phone call happening in the middle of reviewing a patient's chart. While it's beneficial to be aware of internal interruptions, external interruptions are the primary focus here, in both medical and psychological literature, because their variety, their perceivability, their frequency, and their effect on clinical outcomes far outweigh those of internal interruptions. Now, formally, an interruption is defined as a stimulus which demands additional attentional resources to those already being used to conduct a separate task. To break this down, let's look at two major components to any interruption. We have the primary task, which is the task that is currently being performed when the interruption occurs. In other words, this is the task that is being interrupted. It's what you're doing right now, you're getting it interrupted. Then we have, of course, the interrupting task. This is the task that is doing the interrupting. It's interrupting the primary task. Here's how they work in practice. So let's say a nurse is documenting a patient assessment when she's immediately called to the desk by her manager. The primary task here would be documenting a patient assessment because that is the task that this nurse is already engaged in and in the middle of doing. The interrupting task would then be the call to the desk. This task is interrupting the patient assessment, right? So now there are two more parts of the interruption to be aware of before we continue here. The interruption cue and the interruption lag. The interruption cue is the exact moment where an interruption is first presented. Now, since this is a moment in time, let's break down in our example and see what happens here a little bit. Now, to receive the interrupting task, in this here example, the nurse needs to, first, hear the phone ring, second, pick up the phone, and then third, listen to the manager tell her to come to the desk. The actual interruption cue doesn't happen until here, when the manager tells the nurse to come to the desk. It is not until this point that the interrupting task is actually introduced. Picking up the phone doesn't introduce it. Asking the manager what's going on doesn't introduce it. You have to be told what the task is for it to be the interruption cue. Now, because of this, you can think of the interruption cue as simply the introduction or presentation of the interrupting task for the first time. So now that we've received the interruption cue, obviously we need to choose what to do next. Now, whether we choose to interrupt the primary task to attend to the interrupting task, or choose to finish the primary task first, or any number of choices beyond that, we're going to make a choice of some kind about what to do. So let's call this choice task onset for now. Now, between the interruption queue and task onset is what we call the interruption lag. This is a gap that is defined as the period of time after the interruption queue, but before task onset when you actually choose to do something. So we're taking our example here. Let's say my decision, given this interruption, is to stop what I'm doing and go see what the manager wants. It's between the interruption queue that's marked here and making this decision here that the gap we call the interruption lag exists. The reason we care about knowing when the interruption lag happens is that you will need to use this period of time to identify 3 key properties of the interruption. So in every interruption that you face, there are 3 key properties that you need to identify and consider in order to make the correct plan of action. So first, let's talk about the first one, interruption urgency. Now, urgency refers to the importance of the interrupting task. Essentially, urgency determines the amount of time that you have before the interrupting task has to be attended to. So let's use a similar example to the one that we had here before, right? The nurse is documenting a routine patient assessment when she's called to the desk by the manager to discuss scheduling. Here, the documenting is the primary task, and the call to the desk is the interrupting task. Since urgency is looking at the interrupting task, we're deciding here how important the call from the manager is. It can be helpful to rate things on a quick 1 to 10 scale, with 1 being the least urgency possible and 10 being the highest possible urgency. Discussing scheduling is necessary, but it's definitely not the end of the world, and the patient's needs are always going to trump this. So urgency here is probably a 1. The second property to look at is going to be our cost of interruption, or the COI for short. So the COI refers to the importance of the primary task. More accurately, this is an evaluation of the consequences of switching away from the primary task to attend to the interrupting task. In our example here, the primary task is documenting a routine patient assessment. Interrupting this task wouldn't be the end of the world either, but leaving it in the middle does run the risk of forgetting where you stopped or making an error somewhere in the documentation. So the COI would be about a 4 here. Not major, but worth considering. The third and final property is relatedness, or in full, relatedness of the interruption to the primary task. So relatedness is the property that determines whether the primary and interrupting tasks can be multitasked or performed simultaneously. This is the least important of the properties, but it is still essential to be recognized. In many cases, relatedness is going to be very, very obvious. In the case of our example here, it is impossible to go to the manager's desk and continue documenting at the same time. They're in 2 different places. So relatedness is going to be a solid 1. Can't do it. Now let's take ourselves through another scenario to really put all of these concepts together in one situation. So imagine that you're starting an IV in a routine patient when another nurse asks you if you can take a blood pressure of a patient in the next room as a part of your morning vital signs. So the primary task here is going to be starting that IV. The interrupting task is going to be taking the blood pressure. And then the interruption cue is going to be the moment when the other nurse asks you to take the blood pressure of the other patient. And our interruption lag is the period of time between being asked to take the blood pressure and then deciding what to do next. So during the interruption lag, we figure out the 3 properties. So urgency, taking blood pressure definitely needs to get done this morning, but it can also definitely wait until you're done administering your IV. So urgency is going to be like a 1 or a 2. COI, right? Pausing your IV process could be very detrimental, but there are definitely situations that you could imagine where you might have to interrupt this task for something more important. So COI is about a 5 here. Definitely pretty good, but not the most important task in the entire world. And relatedness. So it is not possible to check the blood pressure of another patient while starting an IV on the current patient. 2 different patients, 2 different rooms, can't do it. Relatedness is going to be a 1. So now you have the basic knowledge needed to identify the parts of interruption. So far, we've gone over some simple examples with pretty cut and dry solutions. However, real life is pretty complicated, and we need to make sure that we're making the best decisions for each situation. So exactly how each of these 3 interruption properties is identified and how we evaluate them will be discussed further in the next lesson. Until then, be sure to practice identifying the parts of interruptions and make yourself familiar with these properties. Till next time.